This September 28th is International Safe Abortion Day, a day that was first celebrated in 1990 as a day of action for decriminalization of abortion in Latin America and the Caribbean. Well, we're going to focus now on the situation in Malta. Malta, the only country in the European Union where abortion is still illegal. For more on that, let's bring in Isabel Stabile. You're a gynecologist and a member of Doctors for Choice in Malta. Thanks for taking the time to speak to us. First of all, just give us some background here. What's the reasoning? Why is Malta still the only country in the EU not to allow abortion?
I guess because we haven't changed the law yet. The law stands for the last 150 years or so, and we don't have politicians with enough spine, shall we say, to grasp this problem and face it. Most likely because of the strong Catholic faith in the country.
Isabel, we both know that just because abortion is illegal, that doesn't mean that women are not going to need abortions. What are those women doing in Malta now? Are they traveling abroad? Are they getting abortions illegally?
Yes, they're getting abortions illegally. Last year alone, 365 women ordered medical abortion pills online. In the last 5 years, that number is about 950 women. So basically, women are making use of the services of Women on Web and Women Help Women, who are two of the main providers of medical abortion pills. They are ordering the pills online, waiting anxiously for roughly 2 weeks until they arrive, paying about €100 for the privilege, and then taking the pills alone, usually at home, without medical care.
So what are the risks of that, of performing an abortion that way with those medicalized pills and doing it on your own without care?
Well, I mean, luckily, we know that these pills are very safe. They've been tested now across many countries in the world. We know that they have a very, very good track record. When we talk about safety, the risk really comes down to hemorrhage and infection, which are both very rare. Nevertheless, the reality is that these women are taking these pills alone at home. And if they were to bleed heavily, they would need to go to the hospital and lie about what they did, which is, of course, a ridiculous situation.
Abortion is an imprisonable offence there in Malta, with a woman facing up to 3 years in jail or a doctor up to 4, as well as losing their medical license. But in practice, have any women or doctors been actually charged with that in recent years?
Not in recent years. There was one woman who had a suspended sentence a few years back, but that doesn't help in any case. That's what we were saying before. Given that women are virtually ignoring the law and going ahead and having abortions anyway, it makes absolutely no sense to retain this law that does nothing more than cause great pain and anguish to women, the fear of getting prosecuted, and of course, a severe chilling effect on doctors. And we have the best example of that was the case of Andrea Prudente a few months ago, who, as you might remember, the doctors refused to terminate her non-viable pregnancy. And this was at 14 weeks. And they did this because there was still a fetal heart. So she risked her health, she risked her life in Malta. Eventually, she was airlifted to Spain and had the procedures. So the situation really is that lack of access to medical care endangers life and amounts to a breach of fundamental human rights. And this is why Andrea has now filed a case against the Maltese government, and because our government has failed in its duty to provide safety and dignity and placed her life at risk. Thankfully, I also wish to mention that the Minister of Health has promised a revision of Malta's abortion law in the very near future. So yes, it does seem that policymakers are slowly beginning to change their views, and we see this as progress.
In the meantime, Isabel, what is your group, Doctors for Choice, doing to help these women?
Well, what we're doing basically is providing information, and we've done this through setting up a volunteer-run family planning advisory service. And in the last 2 years alone, these volunteers have provided 1,200 women and persons who can get pregnant, of course, with advice and assistance about abortion and all other aspects of reproductive health. So basically, we're doing the work that the government should be doing themselves.
Isabel, obviously abortion is such a personal issue for every woman, but I'm just curious, why are you personally pro-choice?
I'm personally pro-choice because I have seen and heard such awful stories of women, real stories, that it just breaks my heart. Essentially, abortion is healthcare. And when you start looking at it through the lens of empathy and compassion and humanity, you realize that this is something that every person who can get pregnant deserves the opportunity to choose. The point we're trying to make out there in Malta is, please, if you don't agree with abortion, that's perfectly fine. You just don't have one. But please allow the rest of the population that can get pregnant, who wish to end their pregnancy, to do so.
Isabel, thank you so much for speaking to us there from Malta. Isabel Stabile, a gynecologist and a member of Doctors for Choice in Malta, speaking to me on this International Safe Abortion Day. Thank you so much.
You're welcome. Bye-bye.